So welcome to Hypermobility 109, breathing issues in hypermobility spectrum disorder. I think breathing is being appreciated as really important, particularly in hypermobility, because people are so vulnerable. Just a second, I'm going to mute everybody. You can unmute to ask questions. And at conferences recently, more and more people are talking about breathing. So I'm not the only one who's thinking something's going on here. So this is me. I am a professor of physical therapy in the US. And we are here, 109, one more lecture in the series next week. So my objectives for today, by the end of the session, you should be able to describe how relaxed breathing should occur and some of the common ways that we don't breathe correctly, both problems with how we breathe, the mechanics, but also with how often we breathe. Talk about some of the health consequences of not breathing correctly, and to explain or practice one or more healthy breathing patterns, and the couple that I'll be going through in more detail: diaphragmatic breathing, nose breathing as opposed to mouth breathing, and slow breathing. Usual disclaimer: the information is for general purposes and may or may not apply to your particular situation. So always check with your healthcare provider before you start a new treatment approach. However, breathing is generally pretty safe. There are several optional breathing exercises, and you're invited to participate, but if it's uncomfortable in any way, definitely stop. The breathing exercises are safe and healthy for most people, but again, you may have something specific and unusual going on. Before we start with the actual session, I want you to take 1 minute to assess your breathing, and we're going to assess two things about your breathing. One is where you breathe, whether you breathe in your chest. So you're going to have one hand up on your chest bone, your breastbone, one hand on your belly to see whether you're a chest breather or a belly breather. And I'm also going to time 1 minute. And I want you to count how many times you breathe in that minute. And we'll explain why that's important in a bit. So I'm going to start in just a moment. Ready, set, and start counting. And stop counting. So what are we looking for? Well, two things. At rest, if you're sitting or even just standing at rest, only your belly should be moving. Your chest should not be moving. And I'll explain why in a little bit. And then with the breathing rate, the normal breathing rate at rest, that is if you're not exercising, should be somewhere between 8 and 12 per minute. But it's healthier to actually be lower. So a healthier breathing rate would be 6 per minute. So 6 to 8, mine is about 8. And we'll talk about why that's important in a bit. We're going to start with breathing mechanics, how you do it, what muscles you use, make a difference. So the diaphragm muscle is the primary muscle for relaxed breathing. That is when you're just sitting or standing. The diaphragm should be the only muscle working hard to breathe for you. It attaches to the ribs around your chest, and then it forms a dome near your spinal cord where there's a tendinous portion, and then the muscle comes down and attaches to the lumbar vertebrae. The diaphragm coordinates with the abdominal muscles, which would be down below on this picture. and with the pelvic floor muscles, which would be below yet. And those three sets of muscles have to work in a coordinated fashion to breathe effectively and also to stabilize your core. The diaphragm is one of the lumbar stabilizing muscles. It attaches to several lumbar vertebrae, and when it contracts, it helps to compress those vertebrae so that they are stable. If you irritate the diaphragm, it will refer pain up to your shoulder. And there are 14 plus accessory breathing muscles that are normally only active in strenuous breathing. And I'll go through the most important of those in a few slides. During relaxed breathing, so here's a side picture of the diaphragm. Your lungs are above the diaphragm. Air comes in because the diaphragm pulls down and kind of sucks air in, kind of like a piston or a syringe pulling air in. When the diaphragm pushes down, it pushes the belly contents out, which is why your belly goes out when you use your diaphragm to breathe, and why we call it belly breathing. So the diaphragm is working by pulling the air in. When it contracts, it also expands the ribs a little bit. And as I mentioned, it pushes your organs in the belly out and causes the belly breathing. There are some muscles between the ribs here that can help to lift the ribs as well, but they're generally not very active when you're relaxed. Mostly the diaphragm. The diaphragm does 60 to 80% of all your breathing at rest. When you exhale, much of the action is just recoil, that your body recoils. So the dotted line is where your ribs are when you finished inhaling, and you exhale, or you just allow the air to go out, and the ribs spring back by the elastic nature of the muscles and ligaments, and the diaphragm muscle relaxes back up to its normal location. So normally when we exhale, elastic recoil does most of pushing the air out. We don't have to actively use muscles to push the air out most of the time. There are accessory muscles as well. So the way this picture is organized, on the left are the muscles of inspiration when we inhale, on the right are the muscles of expiration when we exhale. And there is the primary muscles and the accessory muscles. So we've been talking about the diaphragm, which is our primary muscle for relaxed breathing. Let's see if I can get myself a laser pointer here. But when we're breathing vigorously, when we're exercising, we have some accessory muscles that can help us. So the sternocleidomastoid, which is a neck muscle, the scalenes in the neck, the pectoralis minor in the chest, all help with breathing when we're exerting ourselves, or if we're chest breathing. When we exhale, if the active recoil isn't sufficient, we have some intercostal muscles, they pull the ribs together, and we have abdominal muscles that help with exhaling by squeezing the guts back in, pushing the diaphragm back out, and propelling the air out. But what happens is that sometimes we develop bad habits and we start using these accessory muscles for relaxed breathing, and that's where problems happen. So for diaphragmatic breathing, if you're practicing, you want to imagine the air coming in, and imagine the air coming into your belly. And of course, it's not really going into your belly, but when the diaphragm pulls down, it pushes the belly out. And then when you exhale, your abdominal muscles may recoil, or you may activate them to help push the air back out to exhale. If you have trouble doing it upright, you might try learning lying down, putting your hand or something on your belly, and your brain will often figure out how to lift your belly in that way. Sometimes people have a lot of trouble figuring out how to do diaphragmatic breathing, so don't get frustrated if it is difficult for you. One good exercise for retraining or for strengthening your diaphragm and your abdominal muscles is singing. And I actually encourage this for a number of my patients. It's a lot more fun than doing crunches and other strengthening exercises. So when you inhale strongly to sing, you're activating your diaphragm. And when you project your voice, you're activating your abdominal muscles. And so it's really a very good exercise. You get some bonus points because singing also activates the vagus nerve, which helps to cause a relaxation response and calm your nervous system down. It can be fun and social. And if you think about it, chanting, group singing, have been parts of many cultures for centuries and centuries. So what happens if you don't use your diaphragm muscle correctly? Well, you may end up overusing the accessory muscles in the neck and the chest. And I'll go into some detail about symptoms you may have if you do that. You may have problems with swallowing, sleep apnea, where you stop breathing at night, sleep disturbance, asthma, shortness of breath, decreased tolerance to exercise or activity. You may have too much arch or lordosis in your low back. It can contribute to lumbar and pelvic instability, which people with hypermobility are already very prone to. It can lead to low back muscle spasm, low back and sacroiliac joint pain, weak hamstrings and abdominals. It actually will decrease your heart function. I'm not going to talk about that much, but the diaphragm actually is attached to the heart and helps to pull blood back into the heart. Decreased lymphatic fluid movement through the body. So you get fluid buildup in the abdominal area, particularly a problem for people with POTS. And not using your diaphragm can increase anxiety, stress, and sympathetic nervous system activity, which is not good. And it can contribute to migraines. So there are a lot of health issues associated with not doing diaphragmatic breathing. And I haven't even gotten to the gut. So the gut is what's below the diaphragm. So you've got your liver on one side and your stomach, and then your intestines below. And every time the diaphragm contracts, it moves those organs around in a healthy way. We know that dysfunction of the diaphragm increases gastroesophageal reflux, or GERD. So GERD happens when the stomach, which is right below the diaphragm here, and the esophagus, which goes up to the throat. The sphincter right there is near the diaphragm, and if it's not functioning properly, we can develop GERD. And research shows that you can do diaphragm exercises, strengthening exercises, to treat GERD. Also, a lack of coordination between the diaphragm and the abdominal muscles is associated with irritable bowel syndrome. And so it contributes to irritable bowel. And decreased diaphragm function increases pain sensitivity of the gut. So you have a lot of nerves in the gut, and the diaphragm helps to keep those nerves calm, in part by sort of massaging the vagus nerve. The vagus nerve comes from your brain, and it comes all the way through your heart and lungs into your gut. And every time the diaphragm contracts, it kind of squeezes the vagus nerve, massages the vagus nerve, which helps to decrease inflammation in the gut and gut-related pain. And then diaphragmatic breathing can be used to treat constipation and some of the delayed gastric emptying disorders. Diaphragms are muscles, so they can have trigger points, just like other muscles can have trigger points. If you ever ran around when you were a kid and got a stitch in your side, it was probably a trigger point in the diaphragm. That often people will get very sharp pain at the bottom of their ribs, but you can also get mid-central chest pain. Trigger points in the diaphragm can be aggravated by poor posture, weak abdominals or abdominal surgery, abdominal trigger points, pectoralis or chest muscle trigger points, emotional stress, lumbar instability, coughing or vigorous exercise where you're breathing really hard, and asthma. Some of the other accessory muscles that can cause or develop trigger points when you are chest breathing include the sternocleidomastoid, and we saw this last week because it's a big contributor to headaches. And you can see the red areas here showing where a person might have pain from this muscle. You might have headaches, ringing in your ear, fullness in the ear, tinnitus, sinus congestion, nausea, and dizziness. And that tight sternocleidomastoid can cause a forward head, which can increase cervical instability, which people with hypermobility are already vulnerable to. Another common muscle that is overused when you're a chest breather are the scalene muscles. It's actually a set of 3 of them. They attach to the first 2 ribs, so they help to lift the rib cage. When they develop trigger points, you may have chest pain. It can actually feel like pressure on the chest, almost like a heart attack, pain that goes down the arm, into the hand, and between the shoulder blades. And this is a really common trigger point in people with hypermobility. So it can cause chest and upper back pain, and numbness radiating into the arms and hands. It can feel like a heart attack. It can cause thoracic outlet syndrome. There's some nerves that come from the neck and they go through these muscles into the arm. That can cause pain, numbness, and swelling into the arms and head. And the muscles, if they pull on these top 2 ribs, can cause costochondritis on those top 2 ribs. And I'll come back to costochondritis in a bit. The pectoralis minor muscle attaches to some lower or mid-range ribs. It also helps to open the rib cage. It's another muscle that you use if you're a chest breather. It causes chest pain and pain coming down the arm. And it can aggravate costochondritis by pulling on the ribs as well and pulling them out of the breastbone. And it can also cause thoracic outlet syndrome, that compression on the nerves going into the arms. So I've been mentioning costochondritis. So the word costo refers to ribs. Chondro refers to cartilage. There's an area of cartilage between where the ribs come and the breastbone. And that area can get irritated in costochondritis. It's usually ribs 2 through 5. So these that are shown in red. The pain can be either a dull aching or sharp or pressure, and it can also feel like a heart attack. I've had a number of patients who've come to me saying, you know, I had this terrible crushing chest pain. I went to the hospital and they did all these heart tests and they told me my heart was fine, but I still had this terrible crushing chest pain. And it turned out that they had costochondritis. It's aggravated by deep breathing into the chest because you're pulling on those ribs. And if you're hypermobile, those ribs are loose and they tend to get looser. The pain, you'll have tenderness and pain where these ribs connect to the breastbone. So right around the breastbone will be very acutely tender. And there's a test for it, but not many people look for this. And so not many people are doing the test. So why are people with hypermobility so vulnerable to these breathing disorders? Well, diaphragmatic breathing can be inhibited if your abdominal muscles are overactive trying to stabilize an unstable lumbar spine. So if your lumbar spine is wobbly, you've probably been told, oh, well, you need to activate your core muscles. Well, if you activate your core muscles all the time, the diaphragm has to fight against them to pull the air in. And so the diaphragm sometimes just gives up and says, forget it, just do chest breathing, it's easier. Some people will use incorrect muscles to stabilize the lumbar spine. So there are abdominal muscles that are supposed to stabilize, but if you're using muscles that are supposed to move us around, they will interfere with the diaphragm, the pelvic floor as well. Sometimes the pelvic floor muscles are tense or bracing because they're trying to stabilize an unstable sacroiliac joint. Stress and anxiety tends to make us do more chest breathing, poor posture. And people with hypermobility tend to have decreased body awareness, and so they're more likely to use muscles incorrectly. I'll sometimes teach people about diaphragmatic breathing, and they're like, I had no idea that there was a right or wrong way to breathe. And then an added problem for women is that women have been told by our society to suck our guts in so that we look good. And if you suck your guts in, you can't do diaphragmatic breathing because your belly has to be able to move to do diaphragmatic breathing. Okay, so I'm going to pause for questions. Feel free to unmute yourself, or you can post a question in the chat if you like.
Yeah, I got a question, Leslie. That was wonderful. When we did that funny breathing thing before, I did 22. So what the hell does that mean?
You hold on to that thought. We're going to get to the speed
Okay.
of breathing later on in our presentation. So
yeah, thank you.
Yep, we'll get there. Any other questions? Now I know why I don't get the there we go. Okay. Well, I don't use the little red dot more often because I can't move things on my screen. Okay. So do feel free to post. Oh, hang on. There's 2 questions in the chat. So breathing course is the best thing ever, has reduced GI reflux, and it took about 4 to 6 weeks to learn. And now your body does it automatically. So that's great input. I've heard a number of people who have really focused on learning to breathe correctly and had a lot of health benefits. So thank you for sharing that. So another question, can costochondritis cause popping in the breastbone? So costochondritis is irritation of the cartilage here, but if you have popping because it's unstable, then that will cause costochondritis. So yes, the 2 happen together, but the cause and effect is the other direction, that the unstable bones cause inflammation and cause the costochondritis. Hopefully that answered your question. Okay, I'm going to keep going, and again, feel free to put questions in the chat anytime. Okay, so nose breathing versus mouth breathing. Nose breathing is better. So it helps to improve function of the diaphragm, that it gives the diaphragm a little bit of resistance to pull against. It helps to prevent colds, flus, and allergies by filtering air. So you have a lot of hairs in your nose, and it filters allergens out of the air before they get into your lungs. It actually improves oxygen absorption, airflow, and blood flow in the lungs. Excuse me. So it makes your breathing more efficient, both in terms of the air getting in, but also the oxygen getting from the air into your blood. It improves parasympathetic nervous system activity. That's good. So your vagus nerve improves, and that helps to calm and relax the body. It slows your heart rate, which is healthy, and it helps to improve digestion. Nose breathing improves the position of your tongue, which actually improves the alignment of your teeth. It turns out that people who are mouth breathers have, they develop a different shape to their jaw as a result. Nose breathing decreases the chance of snoring or sleep apnea. And it also decreases temporomandibular problems or jaw problems compared to mouth breathing. If you're mouth breathing, if you think about it, you have to hold your mouth open. And so those muscles that hold your mouth open are working all the time, and they're not supposed to work. And so that causes TMJ problems. So some of the hazards of mouth breathing, this comes from a really interesting article by someone named Ruth. So it brings unfiltered and poorly humidified air into the lungs. We've talked about the chest breathing. We'll talk about over breathing when we talk about our rate. Bad breath and dental decay, changes the shape of your jaw and palate. It can change the position of your teeth and lead to your teeth not fitting well together, make you a noisy eater, and lead to enlarged tonsils and adenoids because they're more at risk of infection. So nose breathing is much healthier. But I sometimes have patients who say, well, I can't nose breathe because my nose is congested, my sinuses are congested, and I can't. And then that becomes a vicious cycle, because if you're not breathing through your nose, then there's no reason why it shouldn't just be filled up with gunk. So there are actually breathing exercises to help decongest the nose. And so I'm going to walk you through this. This is also shown in a video, a YouTube, if you want to go through it on your own. I'm going to talk through the instructions. There's one place where the original instructions say to nod your head back and forth, because people who are hypermobile often have neck issues. I encourage you to not do that unless you know for sure that's safe for you, but you can tip your body back and forth. The idea is to change the angle of your sinuses. You can do that without moving your neck. So the idea is that you take a silent breath in, obviously through your mouth, because your nose is congested, and you're going to exhale a normal breath. And then you're going to hold until you develop an air hunger. That is, you feel like you need to gasp some air. You're going to pinch your nose as you hold your breath, and you're going to be nodding forward. And you want to hold your breath for as long as you can until you feel like you can't hold it anymore. And then you let go of your nose and breathe as relaxed as you can. So it would be inhaling, exhaling, hold my nose, tip my head, hold my breath for as long as possible, and then try to breathe in through the nose if you can. And you can repeat it up to 6 times. So this is one strategy that you can use to help clear your sinuses so you can be a nose breather. Just looking at a comment here. The more you nose breathe and get it right, and helps to clear your sinuses. And Deirdre says she took the Buteyko course. So Buteyko is a whole science of breathing correctly. And many people swear by it. I don't know the details of it. I stole this exercise from them. But it's an interesting perspective. Okay, so let's assume that now you can breathe through your nose. Another form of a breathing exercise is called alternate nostril breathing or single nostril breathing. And this is a really common yoga practice. And the way I'm going to talk you through it, we're going to do alternate nostril breathing. We'll do one and then the other, but you can do just one side or the other side, and they have different effects on the body. So if you do just the left nostril, that helps to improve vagus nerve activity, parasympathetic activity, and that helps to calm your nervous system. If you do right nostril breathing, it increases sympathetic activity, which can help energize you if you're feeling tired. So the way it goes, and we're going to go from 1 through 6. Again, join in if you would like to. Don't if it's uncomfortable in any way. So what you're going to do is use your thumb and your 4th finger, and you're going to close your right nostril, right nostril with your thumb. Breathe in through your left nostril to a count of 4. And then you're going to use your ring finger to close your left nostril. Just hold it briefly and then exhale through your right nostril for a count of 6. Breathe in on the right for a count of 4. Hold for a moment and then out for a count of 6. So I'll talk people through it with the counting if you'd like to try it. So close your right nostril, breathe in, 2, 3, 4. Switch to closing your left nostril, breathe out, 2, 3, 4, 5, 6. Breathe in through your right nostril, 2, 3, 4. Close your right nostril, breathe out through your left, 2, 3, 4, 5, 6. Breathe in through your left, 2, 3, 4. Switch to close your left, breathe out through your right, 2, 3, 4, 5, 6. Breathe in through your right, 2, 3, 4. Close the right and breathe out through the left, 2, 3, 4, 5, 6. And the idea is that that gets the air circulating through the sinuses in your skull so that it opens up those sinuses. And as I mentioned, if you do just left or just right nostril breathing, you may have a different effect. So you would just hold one side and breathe through the other side. Okay, so there's a question about air hunger, and yes, I will come back to that because that's going to be relevant when we talk about slow breathing. Okay, so a little bit of technical information. You're welcome to zone out if you don't want to pay attention to this, but nitrous oxide, so that's one nitrogen and one oxygen, is actually a beneficial molecule to help us breathe properly. And when you nose breathe, it increases the nitrous oxide level in your nose because your sinuses actually metabolize the air and produce nitrous oxide. And that's a good thing. Getting nitrous oxide into the blood helps to decrease your blood pressure in a healthy way. And it increases how much oxygen gets absorbed through your lungs. So it helps to make your lungs more efficient. The nitrous oxide is antifungal, antiviral, and antibacterial. So having that in your sinuses helps to fight off any type of infection, that the nitrous oxide can help to break down fungal, viral, and bacterial infections. And nitrous oxide, you know, I just realized this, everywhere it says NO, that's nitrous oxide, not the word no. Nitrous oxide improves your cardiovascular health and your immune function. So nose breathing helps in all of these ways. So it's much healthier than mouth breathing. If you are a mouth breather, it's well worth the time and trouble to try to retrain yourself. The eustachian tube connects the ear to the throat, and often people who have breathing problems will have a clogged ear. So you feel like your ear is plugged, sounds may be muffled, you may have popping or clicking in your ears, pain or ringing in your ears, you may have balance problems. And the Buteyko breathing is one strategy for clearing the eustachian tube. There's some other techniques where you would yawn, hold your nose as though you're going to blow your nose, pop your ears, and then swallow. And what that does is it kind of stretches out the eustachian tube to unblock it. So also related to breathing. Another aspect of breathing is how the muscles acting on your rib cage change your rib cage. So there's an angle at the bottom of your rib cage. So if you find your breastbone, and then you come down to the bottom where the ribs flare out, the angle will be somewhere around 90 degrees. Normal is 90 degrees. If it's wider, it's called a wide infrasternal angle. So if it flares out like that, and that means that your inhaling muscles are stronger than your exhaling muscles. If the infrasternal angle is narrow, like shown here, it means your exhaling muscles are stronger than your inhaling. So the abdominal muscles that pull the ribs down and in are stronger. And this can lead to problems in rib function, breathing, spinal stability. There are some things to do about the infrasternal angle. So you may have heard the blowing up the balloon exercise or fogging the mirror exercise. These are ways to change how you use your abdominal muscles for breathing. But that's something that's best to do with a trained movement specialist who can work with you. Okay, so opening for questions again. So there's a question Ashley posted. So the air hunger, forgetting to breathe and then suddenly gasping to air. So there are two parts to that question. So that's a great question. There's the forgetting to breathe part where you stop breathing until you get that air hunger and then you kind of, and I'm actually going to show you an example of that in a couple of slides. And I don't know if it's more common in EDS than in other people. And one of the ways to address it would be to slow down your breathing, and we'll be talking about that. Deidre says, I used to get major pain in my ears when flying and landing, and it felt like someone was putting a knife through her ears, and correct breathing is taking this issue away. And she no longer needs her asthma medicine. So Deidre is an excellent role model for the importance of breathing correctly. So thank you for sharing that. One person who took who came to this lecture of mine in the US got so inspired, she signed up for a 3-week breathing course that was being taught by a professional flautist. You would imagine that people who play the flute know how to breathe. And she said it was amazing. So it's on my to-do list when I'm not doing other things. Okay, I'm going to keep going. There'll be more time for questions at the end. So slow breathing, several of you have asked questions about this. How fast you do it really does make a difference. We need a little terminology here. So the graph here, the black line is showing air going in and out of your lungs. When the line goes down, you're exhaling, inhaling, exhaling, inhaling. And when you're breathing at rest, we have what's called the tidal volume, kind of like the tides in the ocean that go in and out. And there's sort of a normal range that they usually go through. You can take a deep breath in, and that fills the inspiratory reserve volume. And you can exhale as far as you possibly can and release your expiratory reserve volume. That total amount of air from the most you can breathe in to the most you can breathe out, basically what you'd use to blow out your birthday candles, is called your vital capacity. And that's most of your lung space. There's a little bit of a residual volume because your lungs are never completely empty. Most of the time, we're at this tidal volume where we're just doing gentle breathing, and it should be smooth and regular. However, and this gets to the people who stop breathing unintentionally. So here we have a picture of somebody who's breathing. They inhale, exhale, inhale, exhale, inhale, and then they just sort of stop breathing. They're not deliberately holding their breath, but they just kind of forget to breathe. And they develop that air hunger. And then they take a deep breath in and give a sigh, but then they'll tend to hyperventilate. That is to breathe more rapidly and deeper. And that hyperventilation causes some problems. And then they'll eventually slow back down to their normal breathing. And so we have several problems here. One is the breath holding, and the other is the hyperventilating. So what are some of the benefits of slow breathing? I mentioned earlier your optimal function is at 6 breaths per minute. That's 5 seconds to breathe in, 5 seconds to breathe out. The alternate nostril breathing had a 4-second inhale and a 6-second exhale. If your exhale is a little longer than your inhale, it's even better for you. Doing slow breathing helps the diaphragm to move and function efficiently. It allows you to be more efficient breathing so that you're not using so much muscle energy. It improves your heart function as well. It improves your heart rate variability, which is a measure of your autonomic nervous system function. And the higher your heart rate variability, the healthier your autonomic nervous system is. So it's improving your parasympathetic nervous system function, which is good. It improves your vagus nerve function, which is good. And that in turn improves your gut function. So slow breathing can help your gut. It improves your response to position changes. So this is particularly helpful for people with POTS who tend to get dizzy when they sit up or stand up, that the slow breathing helps to stabilize your autonomic nervous system. And over breathing, that is breathing too fast or too deep, that hyperventilating that we just saw, causes lots of problems. There's an interesting history of slow breathing. If you look at different cultures Almost every culture has a chant or a prayer that slows breathing down to about 6 breaths per minute. In the Catholic religion, the Ave Maria and Rosary prayers take about 10 seconds, 10 to 12 seconds total. The Buddhist chant, yoga, Hindu, Taoist, Japanese, Hawaiian, all have some chant or prayer that you breathe in, you say the words, that is a full exhale, you breathe in again, and you do it again. So a lot of cultural history has encouraged slow breathing. And if you're interested in learning more about that, the Nestor book, Breath, The New Science of Lost Art, is really fascinating. And then we have the movement arts, yoga, Tai Chi, and Qigong, which encourage slow breathing. And they have thousands of years of human experience, that there's got to be something about it that is healthy. So we're going to do a short, slow breathing practice. If you'd like to join in, you're welcome to. If not, that's fine too. I'm going to switch my share to a YouTube. So you should be able to see the YouTube. If you can't, somebody please tell me that. And just follow the instructions. So breathe in when it says in, and out when it says out. Okay. Oops. Okay, you should be back to the slides. If you can't see the slides, somebody tell me. So that basic slow breathing, and they started out with about a 3 and 3 inhale, exhale, then went to 4 and 4 and 5 and 5. So they gradually made it slower, because the 5 seconds in, 5 seconds out is often not natural for people. A lot of the wearable fitness watches have breathe functions on them. So Apple Watch and Fitbit have very similar breathe functions on them. So one of the very simple breathing exercises that people can do is called 365 breathing. And they say 3 times a day, but once a day is still good. But you breathe 6 times per minute. That's 5 seconds in, 5 seconds out, and you do that for 5 minutes. And I try to encourage a lot of my patients to at least do it once a day for 5 minutes. It is normal to feel a little lightheaded or air hungry at first. You don't, if that happens, don't go quite so slowly that you may need to work up to the 5 seconds, 5 seconds. The symptoms of feeling lightheaded tend to subside after a couple of weeks as your body gets used to it. So I've been talking about the autonomic nervous system and how the slow breathing helps to support the parasympathetic nervous system, which controls a lot of your digestive tract. And so it can help to stabilize your digestive tract. The sympathetic nervous system, your fight or flight nervous system, is the one that gets us all riled up. And it's the one that's overactive when you have a POTS episode, when your heart starts beating really fast and you feel flushed. And the slow breathing helps to stimulate the parasympathetic nervous system. The vagus nerve in particular, it controls much of the parasympathetic nervous system, and the slow, deep breathing helps to activate the vagus nerve. And the vagus nerve not only sends signals down to the gut to control the gut, but it also sends signals back up to the brain that create a sense of peacefulness, that tell your brain that, yes, the body is okay. Heart rate variability, I mentioned that in an earlier slide. That's a way of measuring your parasympathetic function. A higher heart rate variability is good. That means your parasympathetic system is doing well. And there are biofeedback apps that you can use your phone. So you can actually use the camera on your phone. You just put your finger over the camera and you run the biofeedback, and you can use that to help to calm your nervous system. And there are also dedicated biofeedback units. And you can actually also use your phone to help you with your breathing. I think I've got that on a later slide. A little bit more technical information. So CO2 is what we breathe out. So we breathe oxygen in and CO2 out. But if you breathe too much, that over breathing, when you breathe fast, and this gets back to that question of, well, what if you're breathing 22 times a minute? You're over breathing, and then it actually decreases your CO2 levels. So you're blowing off too much CO2. And when you slow your breathing, it increases your CO2 levels in your blood, which is good. It helps to decrease your blood pressure, decreases migraines, helps to release oxygen into your tissues, your muscles, so that they're healthy. It stimulates digestion through release of gastric acids, helps to decrease airway constriction for people with asthma, decreases constriction of the intestinal organs, particularly for people with constipation. It can decrease fatigue, decrease pain. So slow breathing is healthy. And so if you are an over breather, that is, if you breathe more than 12 times per minute, it's well worth your time to try to practice slower breathing, because there are a lot of health benefits. Okay, so how should we breathe? First, don't get stressed about your breathing. Some people find that thinking about their breathing is just too stressful. Normally, of course, we don't think consciously about our breathing. And for some people, it can be really challenging to try to control it. So don't get stressed. There are some ways to work on your breathing without thinking about it so much. So the yoga, qigong, and tai chi movements all teach breathing patterns. So with Tai Chi, you would inhale when the arms go up, exhale when the arms go down. And you can think about it more in terms of the physical movements and less about the breathing. There are biofeedback apps that can help you with diaphragmatic breathing. So if you remember that picture I showed you at the beginning, lying down and you want your belly going up and down, you can actually put your phone right on top of your belly, and the feedback app will feel whether your belly is going up and down. And then the wearables, the Apple and Fitbit, have cues that can help you with the diaphragmatic breathing. And again, practicing slow breathing can make you lightheaded at first. It usually goes away with practice, but you may want to not breathe quite so slowly yet until your body has had a chance to adjust. This is just one example of a breathing re-education program. So it's from an article in 2021. And he says, start with making sure you're nose breathing all the time when you're awake and asleep. Make sure your tongue is on the roof of your mouth slow down your breathing rate. He actually recommends that you hold your breath a little bit to help increase the CO2 levels in your body. So you remember when we did the right and left nostril breathing, it was breathe in for 4, hold for a moment, breathe out for 6. And so that can be helpful as well. Make sure you're diaphragmatic breathing and don't breathe too deeply. That's one of the other reasons why some people will get dizzy when they slow breathe, that they'll breathe really deep and really deep. And that can make you dizzy. When you slow breathe, you actually want to breathe the same amount that you normally breathe, just do it slower. There are a number of other breathing practices that you can use, and different people like different things. On the left, I have what's called box breathing, where you, here, we'll catch it on the inhale here. So you would breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds. So here we have that holding, which can be helpful. Some people like this because it's super simple. Everything's 4 seconds. And if that's too slow for you, start with 3 seconds. There's another breathing pattern called 4-7-8 breathing, where you would breathe in for a count of 4, hold for a count of 7, exhale for a count of 8. I've heard people have a good response to this, but it's a lot more complicated. And then I've got a link here as well to the Buteyko breathing. So in summary, breathing's a lot more complicated than you might think, and there are a lot of ways that we tend to breathe poorly. The most common ones, we tend to chest breathe, especially when we're anxious or stressed. We tend to mouth breathe instead of nose breathing, and we tend to breathe too quickly or over breathe. And I should come back to the chest breathe, that if your abdominal muscles are really weak, it's hard to do diaphragmatic breathing because you can't push the air back out again. And so I find some of my patients have trouble with the diaphragmatic breathing because their abdominal muscles are too weak, but it's a great way to strengthen them. So research shows that breathing exercises, like the ones that I've showed you today, can help to decrease pain, fatigue, stress. They can improve mood and function. And diaphragmatic breathing in particular can help to manage GERD or indigestion and constipation. So there are a lot of health benefits to doing breathing exercises. I have a list of some resources. So there's an article on proper breathing. If you want a short read, it's really excellent. If you are interested in a longer read, this is a book on breathing, which is fascinating. This is an example of a yoga book that has a 3-week breathing program. There's a lot of information out there now. These are my scientific references, and thank you. And I will open for questions. So I'm going to come back to some of the questions that are in the chat. So coming back to Ashley about the forgetting to breathe. And I don't know that it's more common in EDS, but I think it probably is. But it's a dysfunction when the breathing control isn't well regulated. And some of the breathing exercises that I've discussed, the slow breathing, make sure your diaphragmatic breathing, might be helpful. Deidre says, I used to get a lot of pain in her ears when she was flying, like somebody was putting a knife through her ears, and correct breathing has helped to fix that. So that's good. Oh, am I, so Deidre was saying she does one breathing cycle in 15 seconds, which is really impressive. Don't try that at home unless you're trained properly. Any questions? Feel free to unmute yourself, and I'm going to stop the share so that we can see who's here. Deirdre, do you have any specific breathing classes that you recommend?
I did the Buteyko course, and it was one of the best things I ever did. I was really, really sick because I was also an undiagnosed celiac at the time. And the functional nutritionalist I went to see said, the first thing I want you to do is a breathing course. So I went off and did it. It wasn't cheap. It was about $700, but I've never looked back.
And did you do that in person? Was that pre-COVID?
Way pre-COVID. I did it about 2 years ago. So I think it's at the amygdala in the brain that learns to retrain, because I think we're all born naturally nose breathers. And when you learn how to rebreathe through your nose as an adult, your whole brain remembers how to do it, and you just do it naturally.
Fascinating. Are there any other questions or comments? Anybody have any experience with learning any breathing strategies? One interesting thing about diaphragmatic breathing, if you do it sitting upright, then it's more work for your abdominal muscles, less work for your diaphragm, because it's easier for the diaphragm to push your gut out. But then when your abdominals have to contract to push the air back out, if you do diaphragmatic breathing lying down, it's more work for your diaphragm, because your diaphragm has to contract and push your abdominal organs up. And so some people will find that they have a lot of trouble with diaphragmatic breathing in one position more than the other. When I last gave this lecture, somebody said their breathing rate was like 20 when they were upright, but then when they lay down later in the lecture, their breathing rate went down. And so you might pay attention to how your breathing changes, whether you're upright or lying down. Brittany says she's been doing breathing and mindfulness for rehab, and it's definitely helped. Oh, and you like the 4-7-8 breathing. That's great to hear. Yeah, people who actually take the time to learn it say they really like it, but it is a little complicated. I'm a little reluctant. I tried teaching it to some of my older patients, and I think they got overwhelmed and flustered. And so I stick with simple things now. And interesting that it helped with headaches as well. So that's good to hear. Any other comments, questions, personal experiences with breathing? It's a really powerful tool, and we all have it 24 hours a day.
Yeah.
And so I really encourage people to take some time to reflect on whether you're breathing as well as you could be, because it might be an easy way to improve your health, 10, 20, 30%, with no drugs, no surgery.
I agree. I would strongly recommend, if you don't do anything else in your life, then go and do a breathing course. We do it automatically. We don't stop and think about it, but it does actually make a huge difference to your health. Yeah. And you don't know, because you've probably been breathing this way for decades. That's right.
Yeah. Sometimes when I give this lecture, people, it's like, you mean I've been breathing wrong for 80 years and nobody told me?
Mm-hmm.
But it's become much more on our mind. We're thinking about it. A lot of the health professions are thinking about it more now. So, okay, well, next week is our last session, and it's on lumbar instability, another topic near and dear to my heart. So hope to see some of you guys there. If not, be well and take care. Pleasure talking with you.